Okay, now we'll see two important concepts in carpal bone dislocation. These are quite complex topic, but we'll make it as simple as possible. Okay, there's first thing is when carpal bones undergo either degeneration or some trauma because of trauma or degeneration, they happen to have instabilities. Okay, and later on they can also cause some complications. Okay, so these instabilities, there are two very important instabilities. One is DISI, other is VISI. And complication because of these instabilities, it can be SNAC and SLAC. So this is a brief outline of how these instability and complication develops. Okay, so now we'll first see about this DISI and VISI, what these things are. So coming to DISI, okay, so first let's see what DISI and VISI are. Okay, these, as I said, these are instabilities in the carpal bone. Okay, and DISI stands for DISI. It stands for dorsal intercalated segmental instability. Okay. Dorsal intercalated segmental instability. And VC is volar. Rest everything is the same. Volar intercalated segmental instability. Okay, so let's see what these two things are. So to understand this DISI and VC, just remember these things. Just assume there are three boxes. Okay, there are three boxes. One is, there's one box over here, there's another box here, and there's one more box over here. And these are the proximal carpal bones, which are the scaphoid, lunate, and triquetral. Okay, and between the scaphoid and the lunate, as you know, there's a ligament. Okay, there's a ligament connecting these two. They keep them in position, which is the lunate ligament. Okay. And there's a ligament between the triquetral and the lunate, which is the lunotriquetral ligament. Lunotriquetral ligament. Okay. So these two ligaments hold the lunate in place. Okay. So the naming of these instabilities is based upon where the lunate is. That is, if the lunate is on the dorsal aspect, this is the dorsal aspect, and this is the volar aspect. Okay. If the lunate is on the dorsal aspect, the naming is based upon that, and if it is in the volar aspect, the naming is based upon where the lunate is. Okay. So when the lunate moves dorsally, okay, the lunate is moving dorsally. So what happens? Suppose, let's imagine the lunate is over here. The lunate has moved dorsally. Just a second. Okay. Okay, the lunate has moved dorsally. So this is the lunate, and the lunate has moved dorsally. So it can only move if there is some disruption in the scapholunate ligament. So there is a disruption in the scapholunate ligament, and the lunate has moved dorsally. And the triquetral will also move along with the lunate. Actually, when I'm saying move, what I mean is it's basically tilting, or it will rock or tilt. It actually doesn't move. The lunate will tilt dorsally, and the triquetral will also move or tilt dorsally along with the lunate, and the lunotriquetral ligament is intact. Okay, this is the first scenario, and this is what happens in DISI. Okay, because the lunate has moved dorsally, the naming is based upon that. This is the dorsal intercalated segmental instability. Okay, and the second case scenario is the lunate is moving volar. Okay. Lunate is moving volar. So what happens? So the lunate has moved volar. Okay, second scenario. Okay. So what happens here? Now the lunate is over here, and the lunate can reach move volar only if there is disruption of the lunotriquetral ligament. Okay. So because of disruption of the lunotriquetral ligament, the lunate is free to move or tilt. Basically, it is tilting that is happening. So the lunate will tilt volar. Okay. And along with it, the scaphoid will also move or tilt. And its scapholunate ligament is intact. And you need to remember one important thing, that the scaphoid bone as such always wants to tilt volar. Okay, scaphoid always whatever happens with other carpal bones, scaphoid always tilts volar. That is peculiar about scaphoid. Scaphoid dreams about tilting volar always. Okay. Whatever instability happens in the carpal bones, you will always see the scaphoid only tilting volar. Okay. So in these two scenarios, for the second scenario is VC, and the scaphoid bone in both the cases, as I said, it will tilt volar here as well as here. In this case also, the scaphoid will tilt volar. Okay. So this is the schematic diagram of what happens in DISI and VISI type of carpal instability. So this is the normal orientation where the lunate and the scaphoid is attached by the scapholunate, and the lunate and the tricutril is attached with the lunotricutril ligament respectively. Okay. And you need to remember this scaphoid, as you know, it is on the radial side. So it is on the radial side. So this scapholunate ligament injury is very common. Okay. So what happens? This DISI is common. Okay. And lunotricutril ligament injury is very rare. So VISI also is very rare. If at all you see VISI, it is so rare that even if you see VISI, it is considered to be a type of anomaly. Okay, and it's not considered as a carpal instability. It's that rare of an occurrence. Okay. So now let's see how this DISI and VISI appears on a lateral view of an X-ray. Okay. So in DISI, as I said, so the normal, I'll draw a normal orientation of the carpal bones. And this is the normal appearance. Okay. Let's see how it appears normally. Okay, so this is the radius, this is the lateral view, okay? And the scaphoid bone comes right, sorry, the lunate bone comes right above the radius, okay? So it will be over here somewhat like this, okay? That is the lunate, okay? And the scaphoid bone will be over here behind it. Okay. It will be actually behind the lunate. Okay. This is the scaphoid. So this part, this will be the anterior or the volar aspect. This is the volar aspect, and this is the dorsal aspect. So this is how the scaphoid and lunate is normally oriented. Okay. And there is something known as the scapholunate angle. Normally it is between 30 and 60 degrees. So let's see the scapholunate angle. This is the scaphoid axis and the lunate axis. Through the lunate, it comes like this. Okay. So the scapholunate angle usually will be, this is the scapholunate angle. It will be usually between 30 and 60 degrees. This is the normal scapholunate angle. And what happens in DISI is, DISI, the scapholunate angle will be more than 60 degree. And in VISI, the scapholunate angle will be less than 30 degree. You can remember it by remembering the shape of VISI, V. Inside the V, it is less than 30 degree. Okay. Okay. So what happens in DISI? Let's see. So this is the distal radius and the lunate. The lunate, as we saw before, it will rock dorsally. So there is some dorsal movement of the lunate. Okay, this is the dorsal aspect, and this is the volar aspect. And what happens with the scaphoid? The scaphoid will, whatever happens, it will always move volar. So scaphoid is like this, so it will move volar. So the scaphoid will move volar like this. Okay. So it was oriented in this direction, then it tilted volar, and the lunate tilted dorsally. Okay. So this is the scaphoid and that is the lunate. And let's see the angle. What happens to the angle? So now you can see the scaphoid axis has moved very much onto the side. Okay, 1 second. The scaphoid lunate angle axis will be over here, and the lunate axis will be going right through it. Okay, so now what we are seeing over here is the scapholunate angle has increased to more than 60 degree. So you can see it normally it is between 30 and 60 degree, and here it has increased to more than 60 degree. So what happened here is the lunate has tilted dorsally in dorsal intercalated segmental instability, and the scaphoid as usual will always tilt volar. So because of that, the scapholunate angle has increased to more than 60 degree. And as I've said, this is the most common. This is very common because there is scapholunate ligament injury is very common. Because of that, because of scapholunate ligament injury is common. Because of that reason, DISI is more common. Okay. And what happens in VISI? This is the radius. Then the lunate will tilt volar. Okay. This is the lunate. It has tilted volar. This is the volar aspect. This is the dorsal aspect. Okay. And scaphoid, which is behind the lunate, will always tilt volar. So now let's see what angle the axis will give. So the lunate axis goes through the center like this, and the scapholunate and through the scaphoid axis goes over here. Okay, so now the angle, as you can see, it has drastically reduced. So the angle here is less than 30 degrees. So now you can see how DISI and VISI can be identified on a lateral X-ray. Now let's see some real X-ray images of DISI and VISI. Yeah, okay, the images I'll show you along with further discussion. Okay,